Welcome guys, welcome to Dr. Anil Box channel. So this is chapter 16 from KD Tripathi. So we are going to study today drugs for the cough and bronchial asthma. So I hope you all understood that we are any we'll start with this. So drugs for cough. So what is cough, right? So cough is nothing but the increased responsiveness of tracheobronchial tree. Okay, increased responsiveness of tracheobronchial tree. So it is protective reflex as okay. So it possesses its purpose is being expulsion of a respiratory secretion of foreign particles from air passages. Of course, what is its purpose? So foreign particle रहेगा, foreign particle को बाहर निकालना है airway से, ठीक है, respiratory systems. So this is only purpose. So it occurs due to the stimulation of mechano and chemoreceptors in the throat, okay, which are a respiratory passage of the stretch receptor. Understood? Why this cough occurs? Because there is a stimulation. Okay, stimulation of what? Stimulation of mechano and stimulation of chemoreceptors. Where they are present? They are present in throat. They are present throughout the respiratory passage, and they are stretch receptors. Okay, in the lungs. So all these, once these are stimulated, then cough will occur. Okay, so cough may be useful or useless. So sometimes it is useful and sometimes it is useless. So useless cough is nothing but non-productive. Okay, so productive cough is what? Useful. Okay, means they cough out the secretion which are located in respiratory passage. Okay, but non-productive cough should be suppressed. Okay, because that can harm our respiratory system. Okay, but useful or the productive cough serves to drain the airway. Okay, so that airway is drained in useful cough, so its suppression is not desirable, may even be harmful, except if the amount of expectoration achieved is small compared to the effort of continuous coughing. Means if he is coughing very less, if the patient is coughing less, okay, I'm sorry, if coughing is more and but expel out amount is very less, okay, very less, then that cough is need to be suppressed. But if it is productive, means once it is, if it is it's expelling lot of secretion with minimum coughing, so we will not suppress that cough. Okay, okay, I hope you have understood. Okay, now, so what we call the cough with expectoration and cough without expectoration. Okay, so dry cough we can also call as a cough without expectoration, and productive cough we also call it as a cough with expectoration. Okay, so may even be harmful except if the amount. Okay, apart from the specific remedies like antibodies, which we'll see in the box, cough may be treated as a symptoms or non-specific therapy. Okay, means without antibiotic, means apart from antibiotic, will suppress is with non-specific therapy, like without except antibiotic, what we can do, the pharyngeal demulcents are lozenges, cough drops, in linctus containing syrups, glycerin and licorice. Okay, all these are pharyngeal demulcent. Second one is expectorant. Expectorant is nothing but mucokinetics. Okay, what they ex, they expel out the thing which are in the track. Okay, foreign track, bronchial secretion, like secretion enhancer. Okay, bronchial secretion enhancer. What are all the? Sodium is the sodium or potassium citrate, potassium iodide, gonopacin or या फिर glycerol gonocalate, balsam of the tolu, wasaka or ammonium chloride. All these are um, expectorant or mucokinetic, and the bronchial secretion. Second one is a mucolytic, bromhexine, ambroxol, carboxystine, or acetylcysteine. All these are uh, mucolytic. Okay. Then antitussive. What are all the antitussive? Antitussives are cough center suppressant. Okay. So what are all that? Opioids. Opioids are one of the cough center suppressant, like codeine, ethyl morphine, and polcodeine. Non-opioids are also there, like noscopine, dextromethorphan, or chlorpheniramine. Antihistaminics are also there, chlorpheniramine maleate, chlorpheniramine, promethazine. Promethazine is one of the drug which is antihistamic. Okay, peripherally acting, like pinoxidazine, adjuvant antitussives. What are all the bronchodilator, salbutamol, and terbutaline? All these are adjuvant antitussives: bronchodilator, salbutamol, and terbutaline. Okay. Demulcents and the expectorants. These are demulcents and expectorants. Okay, we'll see. The pharyngeal demulcents soothe the what they do? They soothe the throats and reduce the efferent impulse from the inflamed or irritated pharyngeal mucosa, and thus provide the symptomatic relief in the dry cough arising from the throat. Okay, so what they do? They will soothe the throat. Okay, and if it is not soothed, means suppose this is throat. Okay, suppose this is throat. Okay, this is throat. Suppose if it is not, if it is dry, it is not soothed, then what? This area will give a signal, or this efferent nerves will give signal to the respiratory center, so it will respond back. Okay, resulting in cough. So once it is smooth, so that irritation is not there, so the efferent ending will not get stimulated. Okay, so hence it will reduce the coughing. Okay, it is nothing but provides only symptomatic relief are there. Now expectorants are mucokinetics. They are drugs which is believed to increase the bronchial secretion or reduce its viscosity and facilitates its removal by coughing. Sodium and potassium citrate are considered to increase the bronchial secretion by salt action. So potassium iodide is secreted by bronchial glands. Potassium iodide is secreted by bronchial gland, can irritate the airway mucosa. So prolonged use can affect the thyroid function and produce the iodism. It is not used now. So guanfacine, Vasaka, and Tolu balsam plant produce products which are supposed to use full. So all these are example. Okay guys, so we'll read examples quite fastly. Okay, so to enhance, what they will do, that will enhance the bronchial secretion and mucociliary functions while being secreted by the tracheobronchial glands. So ammonium salts are nauseating and reflexly increase the respiratory secretion. What they do? Ammonium salts are nauseating, means ammonium salts will increase the nausea. Okay, and reflexly increase the respiratory secretion, so that will increase the respiratory secretion. So variety of expectorant formulation containing an assortment of the above ingredients, often in the combination with the antitussive and antihistaminics, are marked and briskly promoted, but objective evidence of the efficacy of these is not conclusive. The US FDA has stopped the marketing of all the expectorant except guanfacine, because okay, steam inhalation and the proper hydration may be more useful in clearing the airway mucus. So there is one thing, that steam inhalation and proper hydration, it is very useful in cleaning the airway mucus. Okay, now mucolytic. So mucolytics are nothing but bromhexine, so a derivative of a alkaloid vesicine obtained from the Adatoda vasica. Okay, vasica, vesica, Adatoda vasica, So it is bromhexine. It is a derivative of alkaloid vesicine, vesic, vesicine. Okay, vesicine. So which is Adathoda vasaca is vasaca, and it is bromhexine is made from this plant. So is a potent mucolytic and mucokinetic, so capable of inducing thin copious bronchial secretions. So it is depolymerizes and mucopolysaccharides directly, as well as by the liberating lysosomal enzymes network of fibers in tenacious sputum is broken. So it is particularly useful if the mucus plugs are present. Side effects are rhinorrhea and the lacrimations, mucosa, gastric irritation, and hypersensitivity. So what is the dose? Dose is 8 mg TDS, means 3 times a day. Okay, adults. In children's, 4 mg BD, means like twice a day, and 5 to 10 years child, 4 mg TDS. Children between 1 to 5 years, it is 4 mg BD, and children's above 5 to 10 years, it is 4 mg TDS. Okay, so adult 8 mg, child below 5 years is 4 mg BD, and child between 5 to 10 years is 4 mg TDS. Okay, on the it is bromhexine 8 mg tablet is available. Okay, now so ambroxol is what? It is a metabolite of bromhexine having a similar mucolytic action, uses and side effect. So it's the same action as this. Okay, and use and side effects are also there, same. So okay, ambroxol and bromhexine are same. So ambroxol comes in 50 to 30 mg TDS. Dose is what? 50 to 15 to 15 से 30 mg TDS है. और इसके एम्ब्रोलाइट आता है, एम्ब्रोडिल आता है, म्यूकोलाइट आता है. Okay, all this. Acetylcysteine is one of the drug. It opens disulfide bond in mucoprotein. What it will do? It will opens the disulfide bond in mucoproteins present in the sputum, so makes it less viscid, but has to be administered directly into the respiratory tract. So make sure, देखो, acetylcysteine what it will do? It will broke, or it will open the disulfide bond in the sputum. If this is sputum, this is airway, this sputum got stuck here, yeah, or it is less viscid, so we need to break down the disulfide bond in the sputum. So acetylcysteine we use, but the how it is to be administered, it is administered directly into the airway, respiratory tract, so like inhalation. Okay, so mucomix is one of the tract, mucomix. So mucomix is one drug. This is very useful in ICU setup. Okay, 200 mg, it comes in 200 mg per ml injection and 1 to 5 ml ampoules. So injectable solution may be nebulized, after inhalation means nebulized and instilled through the tracheostomy tube. So if the patient is what is it? Tracheostomy tube means if patient is on ventilator, so if it has tracheostomy done, so we can push that this injection directly in the track. Okay, so acetylcysteine is this. So very important, this drug is very important, very frequently used in ICU, so do read this. Carbocystine, what is carbocystine? Carbocystine, it will liquefy the viscid sputum in the same way as acetylcysteine. So the same, carbocystine and acetylcysteine both has same action and is administered orally 250 to 750 mg TDS. So this is the one drug which can be given orally, but this is directly into the respiratory tract. So carbocystine is the one which we can give on OPD basis also. Okay, so some patients of the chronic bronchitis have been shown to benefits. So one who has the chronic bronchitis, so उनको बहुत ज़्यादा यूजफुल हुआ है. सो इट मे ब्रेक द गैस्ट्रिक म्यूकोजल बैरियर ऑल्सो एंड इज contraindicated in the peptic ulcer patients. So if the patient is a peptic has a peptic ulcer, so we cannot give this carbocysteine. Okay, so side effects are gastric discomfort and rashes. So the drug which is mucodyne, 375 mg capsule is there, mucodyne, or directly carbomox is one of them. Okay, so it is also available in the amoxicillin and cephalexin combination for treatment of bronchitis and bronchiectasis and sinusitis. So we can give this in combination with antibiotics. Carbocysteine is also available in the combination with amoxicillin and cephalexin. Okay, so amoxicillin and cephalexin can be given. So you know not drug 375 dose is what? 375 mg capsule. So we will give it with amoxicillin antibiotic. Now antitussive, what is antitussive? Antitussive, okay, before that let me see this. What is this specific treatment approach to the cough? Okay, let's see. Etiology of cough and treatment approach. So what is etiology? Treatment depends on the etiology. Okay, make sure treatment depends on etiology. So अपर एयरवे ट्रैक इन्फेक्शन होगा, सो अप्रोप्रिएट एंटीबायोटिक दे दो, ट्रीट हो जाएगा. स्मोकिंग या फिर क्रॉनिक ब्रोंकाइटिस ब्रोंकिएक्टेसिस होगा, उसके चलते कुछ हुआ है तो सिसेशन, मतलब छोड़ दो स्मोकिंग, अवॉइडेंस ऑफ पोल्यूटेंट्स, मिनिमिनेशन, पोस्चरल ड्रेनेज. ओके, इफ पल्मोनरी ट्यूबरकुलोसिस है उसके वजह से हो रहा है तो एंटी ट्यूबरकुलर ड्रग दे देना. इफ अस्थमेटिक कफ है, ठीक है, तो इनहेलेशन देना उसको बीटा 2 अगोनिस्ट ड्रग का, या फिर कॉर्टिकोस्टेरॉइड या फिर हाइपरट्रोपियम दे देना. ठीक है, कफ इन द पल्मोनरी इओसिनोफिलिया होगा तो उनको दे देना डाइथाइल कार्बामेज़ेपिन साइट्रेट या फिर इनहेल कॉर्टिकोस्टेरॉइड. सो पोस्ट नेजल ड्रिप ड्यू टू द साइनोसाइटिस, सो गिव एंटीबायोटिक, nasal decongestant and H1 antihistamines. Post-nasal drip due to the allergic rhinitis is avoidance of precipitating factor, corticosteroid nasal spray and H1 antihistaminics. Gastroesophageal गैस्ट्रोइसोफेजियल रिफ्लेक्स अगर होगा तो उसको क्या देना तुमको? बेड हेड एलिवेशन मीन्स एलिवेट, मतलब ऐसा डायरेक्टली नहीं सोने का, सो थोड़ा सा 30 डिग्री 45 डिग्री का एलिवेशन करके सोना है. ठीक है, उसके बाद उसको लाइट डिनर देना है, डिनर में थोड़ा देना है, डाइट मॉडिफिकेशन करना है, उसको H2 ब्लॉकर दे देना. ठीक है, इसोफेजियल रिफ्लेक्स है ना, सो प्रोटॉन पंप इनिवेटर देना या फिर मोजा प्राइड नाम की ड्रग आता है वो दे देना. अगर एस इनिवेटर एसोसिएटेड कफ है, सो मेक श्योर दिस इज कैच, देर इज वन कैच हियर. उफ एक हमारे सर ने हमको एक बताया था, केस बताया था, इनफैक्ट मैंने भी देखा था कि एक पेशेंट है जो हर एक डॉक्टर के पास, ये इस डॉक्टर के पास गया, इस डॉक्टर ने अच्छे से अच्छी दवाई दी, ट्रीटमेंट, फिर उसने नहीं ठीक हो रहा है इसलिए वापस वो दूसरे डॉक्टर के पास गया. सो वो डॉक्टर ने भी दवाई दी, पहले वाले डॉक्टर ने एंटीबायोटिक वगैरह सब दिया, नहीं ठीक हुआ, तीसरे डॉक्टर के पास गया, नहीं ठीक हुआ. सो लास्टली मैं जहाँ था वहाँ पर एक वही पेशेंट आया और वो उनको बोला कि सर ऐसा ऐसा है, ये मेरा कफ है, बहुत दिनों से जा नहीं रहा है, 2-3 डॉक्टर को दिखाया लेकिन ठीक नहीं हो रहा है. सो सर took history of it and found to have it is known case of hypertension. Okay, so it is known case of hypertension and he is on medicine ACE inhibitor. Okay, so ACE inhibitor was he is taking. Okay, so and the cough complaint is what? Cough is dry. So because of this ACE inhibitor, so this drug will stimulates the cough center. So because of this drug, this is drug induced cough, so what we have to do, we have to change this tablet, then only this cough will go. So what sir did, sir, change this ACE inhibitor of his antibiotic and start. Okay, so what they do, they ACE inhibitor by losartan, they give losartan, and NSAID may reduce the cough. Okay, so instead of ACE inhibitor means ACE inhibitor जो भी दूसरा एनाल्प्रिल वगैरह ले रहा था उसके जगह पे लोसार्टन दे दो. दूसरा पोस्ट वायरल कफ नॉन स्पेसिफिक ट्रीटमेंट subsides by itself. So if there is a viral cough, then no specific there is treatment, subsides by itself. Automatically it will get subside. Okay. Let's go further. So this is a really important point, okay guys, so do concentrate on this. Now antitussive, what is antitussive? You know what is antitussive, okay. So this drug will suppress the cough. So these drugs that acts on the CNS, this will act on the CNS to raise the threshold of cough center. So अगर ये लेवल पे कफ आता था, अगर ये लेवल पे इरिटेशन हुआ तो कफ आता था, तो अब उसने ये इसका लेवल बढ़ा दिया, तब सेम अमाउंट ऑफ स्टिमुलेशन से भी ये नहीं कफ आएगा सेंटर. सो CNS का थ्रेशोल्ड वो बढ़ा देता है, ठीक है, और act peripherally in the respiratory tract to reduce the tussle impulse, or both of these actions, because they aim to control the rather than eliminate the cough. Antitussive should be used only for the dry non-productive cough, or if cough is noodly tiring, so disturb the sleep, or is hazardous, hernia, piles, cardiac disease, ocular surgery, all these are. Okay guys, so what they are telling that it only you use these antitussive only in these conditions when high hernia, piles, cardiac arrest and ocular surgery are involved. So in this condition, and plus when they have a non-productive cough, then only you suppress the cough. Okay, because it is not going to help us, this cough is not going to help us as it is non-productive. Okay, so because it can disturb our sleep also, it can be hazardous when these conditions are involved. Okay, now we will see opioids. Okay guys, so opioids, in opioids there is a codeine which is very important opioids in our practice. So but this comes under the schedule H. Okay guys, so this comes under schedule H with the, which means this is only available on the prescription of doctor. Okay, this is not the OTC drug. OTC, you understand that OTC is over the counter drug. Okay, over the counter means for this OTC drug you don't need a prescription. Okay, so let's see what is opioid. Opioid is nothing but an alkaloid. It is also an alkaloid, okay, like a mucolytic, an expectorant. This is also alkaloid. So this qualitatively is similar to the less potent than morphine. So it is similar, quality is similar like morphine, but it is less potent like morphine. Okay, but it is a more selective for cough. Okay, cough center. So it is selectively act on the cough center. Okay, so codeine is regarded as standard antitussive. So this is what standard antitussive. codeine को हम क्या बोलते हैं? Codeine is regarded as standard antitussive. Okay, and what it do, it suppresses the cough for about 6 hours, means for at least 6 hours it will suppress your cough. Okay, so the antitussive actions is blocked by, so this antitussive action is blocked by naloxone. Okay, so it's codeine की जो antitussive action है वो कौन block करेगा? Naloxone. Okay, indicating that it is exerted through opioid receptors in the same brain. Why? Because naloxone will go to the opioid receptors, okay, in the brain. So that's why it will block the antitussive action of codeine. Okay, now which means naloxone is what? It is the antidote for codeine. Okay, so abuse liability is low but present. Constipation is means of course abuse it, one can get abused to codeine. Okay, but it's low. The constipation is the chief drawback. Means when you take these all these substances like codeine and marijuana and all that, so the most important drawback is what? They will get a constipation. Okay, so at higher doses, respiratory depression is also there, drowsiness will also occur. Of course, drowsiness is there, but and respiratory depression is the higher dose, especially in the children के अंदर ये जल्दी हो जाएगा. सो ड्राइविंग में भी इम्पेयर्ड. ऑफ कोर्स ये जब ड्रग लेंगे तो उसके बाद हम पेशेंट को क्या बोलना है कि ड्राइव नहीं करना है. कोडेन लेने के बाद हम पेशेंट को बोलते हैं कि डू नॉट ड्राइव, विच मीन्स इफ द पेशेंट, अगर हमको क्वेश्चन में आया कि वी हैव गिवन वन मेडिसिन एंड दैट एंड वी एडवाइज द पेशेंट नॉट टू ड्राइव. ओके, सो यू डोंट ड्राइव. सो विच मीन्स हम सोच सकते हैं कि उसको ये कोडेन दिया होगा डॉक्टर ने, इसलिए ये एडवाइस किया. ठीक है, सो इस टाइप के क्वेश्चन भी आ सकते हैं एग्जाम में. ठीक, सो ड्राइविंग, बिकॉज ड्राइविंग इम्पेयर्ड हो जाएगी उसमें, मतलब दिखेगा नहीं, ड्राउजीनेस आ जाएगी इसके वजह से. ठीक है. दूसरा, like morphine, it is contraindicated in asthmatic and the patients with a diminished respiratory reserve. Okay, should be avoided in the children. Okay, this is if the patient is asthmatic, then do not give this morphine. Okay guys, so and especially in children, don't give. Now I hope you all have understood what about codeine. Okay, so dose is 10 to 30 mg, 10 to 30 mg. Okay, if children is 2 to 6 years, and if 2.5 to 5 mg if children is 6 to 12 years. Frequently use as a syrup codeine phosphate का सिरप आता है 4 to 8 ml का. सो कोडेन की टैबलेट जो आएंगी 15 mg की आएगी, तो लेकिन डोज इस तरीके से 2 to 6 years होगा तो 10 to 30 mg आप दे सकते हो. ना 10 to डोज मतलब 10 to 30 mg का डोज है, लेकिन अगर चिल्ड्रन 2 to 6 years होगा तो 2 to 2.5 mg देना है, 6 to 12 होगा तो 5 to 10 mg देना है. ओके, आई एम सॉरी, गलत बोल दिया. सो टैबलेट जो आएगी वो 15 mg की आएगी. सो और जो ये आएगा लिंकटस, मतलब जो सोल्यूशन आएगा कोडेन फॉस्फेट का, उसके अंदर 15 mg होगा पर 5 ml. ओके, विच मीन्स अगर तुम 10 ml देते हो, इसका मतलब 30 mg डोज जा रहा है उसको. ओके, now further, going further, you will see, you can see this we are studying section 44 and chapter 16. Okay, so now ethyl morphine. What is ethyl morphine? It is also closely related to codeine, which is methyl morphine. Okay, codeine is what? Methyl morphine, and ethyl morphine is another one, and has antitussive respiratory depressant properties also there, but is believed to be less constipating. Okay, so just remember guys, methyl alcohol is a bad alcohol, ethyl alcohol is not that much bad. Okay, so here ethyl morphine. Okay, and the codeine is what? Methyl morphine. Only difference is what? Ethyl morphine is cause less constipation. Okay, the action is same. Okay guys, so now dio डायोनिडॉन ट्रेड नेम है, वो आएगा 16 mg का टैबलेट आएगा. इसका भी डोज 10 to 30 mg TDS दे सकते हैं हम लोग. ठीक है, आगे फॉलकोडिन मीन्स इट हैज प्रैक्टिकली नो एनाल्जेसिक और एडिक्टिव प्रॉपर्टी, बट इज सिमिलर टू द efficacy as antitussives, but it has analgesic or no analgesic or addicting property similar to antitussive like codeine, and is long acting like 12 hours it will get at 10 to 15 mg, half of the codeine and half of the ethyl morphine का dose. ठीक है, so fall codeine guys. Now let's see non-opioid. Okay, now we have seen opioid, non-opioid. In non-opioid, noscopine is very good drug guys. Okay, noscopine के सिरप भी आते हैं. ठीक, so let's see नार्कोटिन का होता है वो. So it is also opioid, opium alkaloid. Okay, it is made up of benzo isoquinoline series. Okay, So it is alkaloid of benzoisoquinoline. Benzoisoquinoline series का alkaloid है ये. Okay, so it depresses the cough. Okay, cough depress करेगा but has no narcotic activity. So why? Because it is a non-opioid. Okay, but it has no analgesic. It don't have analgesic also, and dependence inducing properties also. It not dependence means don't it don't cause dependency. Okay, so it is nearly equipotent antitussive as a codeine, means it is as equipotent as uh, codeine. Okay, especially useful in the spasmodic cough when there is a spasm na, so and it induce cough, then that time you can take this. So headache and nausea will occur because of this. Okay, so occasionally the side effect is what? Headache and nausea. So it can release the histamine and produce a bronchoconstriction in asthmaticus. Oh goodness. So that's why you should not give this in asthma. Okay. So what? Because it release the histamine and can produce a bronchoconstriction. So now the dose is same as codeine, 10 to 15 to 30 mg. Okay, but up to 2 to 6 years you should give 7.5 mg, and 6 to 12 years you can give 15 mg. Okay, and the drug and the Coscopine is the one syrup which is available, and there is a tablet, that Cosco tab, which contains 25 mg tablet, and this Coscopine is 7 mg per 5 ml, which means 10 ml अगर तुमने ले लिया तो इसका मतलब 15 mg गया. आगे now there is very good antitussive drug, that dextromethorphan. So a synthetic central NMDA, that N-methyl D-aspartate. Okay, this is synthetic. Okay, and all of the above which we studied so far in antitussive, all are alkaloid. These are naturally occurring, and this is synthetic. This says this is made in the laboratory. Okay, so what is it? This is N-methyl and D-aspartate. Okay, antagonist. So it will synthetic, it will centrally, there is one receptor, this receptor, it will block this. Okay, so which means this is antagonist, N methyl and D aspartate receptor, NMDA receptor antagonist. It is what? Synthetic central NMDA antagonist. Dextromethorphan is what? Synthetic NMDA receptor antagonist. So it is the D isomer, means dextro isomer, has antitussive action. So, and L isomer has analgesic isomer. So we want antitussive, so we will use D isomer. Okay, what is L isomer will do? L isomer will do analgesics. So dextromethorphan does not depress mucociliary functions of airway mucosa. So this mucociliary function is not going to depress and is practically devoid of constipating actions, means constipation is not there. Okay, so though considered non-addicting, so some drugs abusers indulge in it, but some drugs abuser go in this because it is non-addictive. So the antitussive action of dextro means D, that's why this is dextromethorphan. Okay, dextro D isomer, that's why it is dextromethorphan. Okay, because levomethorphan will all do, levomethorphan will cause what? Analgesic effect. Okay, okay, and this dextromethorphan has been rated equivalent to codeine, but some clinical studies have found it to be no better than placebo. Means some says that it is nothing, it has don't effect, it only effect as a placebo. So it also has some side effect like dizziness, it has dizziness, nausea, drowsiness, and high doses hallucination and the ataxia may occur. So that's why some drug abusers use this in high dose. Okay, so the dose is 10 to 20 mg. 10 to 20 mg. Children 2 to 6 years is 2.5 to 5 mg. and 6 to 12 years it is 5 to 10 mg. So it is common ingredient of many proprietary cough formulation, of course. So it is very common, and it we can found this in many combination of drug of cough. Okay, now we will see the clofedienol. Clofedienol is centrally acting antitussive with slow onset and longer duration of action. So it will act slowly but will work for longer duration. Okay, so it also has a side effect. It has a side effect of dryness of mouth. It can cause vertigo. It can cause irritability in the patients. So the dose is 20 to 40 mg. Okay, and what is trade name of this is Detigon and Tussigon. So the Tussigon contains 20 mg per 5 ml. Okay, this is Linctus with ammonia. So chloride 50 mg and methanol 0.25 mg is there in Tussigon. Now we'll see antihistaminic, guys. So what antihistaminics is H1 antihistaminics have been conventionally added to the antitussive expectorant formulations, and they afford relief in the cough due to their sedative and anticholinergic actions, but lack the selectivity for the cough center. So it will not act selectively on the cough center, but it will give relief from cough. Okay, why? Because they have a sedative and anticholinergic action, but it also, of course, it will not selectively act on cough center. So they have no expectorant properties. Of course, they don't have expectorant properties, but may even reduce secretion by anticholinergic action. So anticholinergic action is what? Secretion will get reduced, of course. So they have been specially promoted for cough in respiratory allergic states. So though their lack of efficacy in the asthma is legendary. Are you getting this line? Have you got this line? They have been specially promoted for cough in respiratory allergy. So they don't have expectorant property. Okay, guys. And what they have written here, they have been specially promoted for cough, which means it is only for cough in allergic states. Okay, so their lack of efficacy in asthma is legendary, means they lack their efficacy in asthma, means no effect in asthma. Okay, and chlorpheniramine CPM. Okay, so CP, only CP. Okay, if they add their maleate, then it becomes CPM. Okay, so it is dose is 2 to 5 mg. Diphenhydramine is 15 to 25 mg, and promethazine is 15 to 25 mg. So Finargan includes this promethazine. Okay, Finargan 5 mg per 5 ml is elixir, which is usually commonly used. Okay, second generation antihistaminics is fexofenadine, loratadine, etc. are ineffective. Chlorpheniramine and diphenhydramine and promethazine 15 to 25 mg, which is pheniramine, Finargan 5 mg per pint, are commonly used. Okay, and second generation antihistaminics are what? Fexofenadine is the second generation, loratadine is second generation. They are ineffective in. Okay, so now let's see again. So peripheral acting antitussives are what? Pronoxidine, prenoxidazine, Prenoxidazine is in contrast to other antitussives. Okay, so this is peripherally acting. Okay, so what we have studied is the centrally acting. Okay, then which this acts peripherally, desensitize the pulmonary stretch, desensitize the pulmonary stretch receptors, and reduces the tussle impulse originate in the lung. So it will reduce the tussle impulse, means which are whatever the impulses originated from the lungs. Okay, so that will desensitize by prenoxidizing. Okay, so they also acts on and also desensitize the pulmonary stretch receptors. So it is indicated in the cough of bronchial origins, whatever, if the pathology is originated in bronchus, so we can give this. Okay, the efficacy is however is not impressive, though an old drug developed in Hungary, it has been introduced recently in India. Okay, Hungary, the old dog is developed in Hungary and which introduced in India nowadays. Okay, so 100 to 200 mg TDS tablet is being the pirinoxide is the trade name, which comes in 100 to 200 mg preparation. Okay, tablet preparation. Then now we'll study about the bronchodilator. So you all know that bronchodilator is very important drug. Okay, so bronchospasm can induce or aggravate the cough. Of course bronchospasm हो जाएगा, फिर बाद में cough होगा उसके लिए. So the stimulation of pulmonary receptor can trigger the both cough also and bronchoconstriction also. So that's why we need to do not stimulate the cough receptor, especially okay, bronchospasm can induce and aggravate the cough. So we do not allow the pulmonary receptors to stimulate. Okay, so especially in the individuals with bronchial hypersensitivity hyperactivity. So bronchial hyperactivity जिनमें होगी उनमें pulmonary receptors को active नहीं करने देंगे. So bronchodilators relieves the cough. What is bronchodilator will relieve the cough? कैसे? In such individuals and improve the effectiveness of cough in clearing the secretions. Okay, secretion clear कर देंगे by increasing the surface velocity of airflow. Surface velocity बढ़ा देगा वो airflow का during act of coughing. Okay, so this is the action of cough. So they should be used only when the element of bronchoconstriction is present and not routinely. So make sure that guys, bronchodilator, don't use bronchodilator every time. Okay, if there is a bronchoconstriction, then only you can use it. Don't use it because it also has a side effect. Okay, their fixed dose combination with antitussives are not satisfactory because of the difference in the time course of action and the components and the liability of a indiscriminate use, which means कि उनका जो प्रिपरेशन आते हैं कि एंटीट्यूसिव के साथ कॉम्बिनेशन ड्रग आता है, ठीक है, वो इतना इफेक्टिव नहीं है बिकॉज the course of action of that component means cough is different. That's why we need to use separately, so that will be more effective. So fixed dose combination of a recently acting antitussive when a bronchodilator or with the antihistaminics having high atropinic activity. So what they have atropinic activity, means anticholinergic activity, and have been banned in India. So don't worry, this is banned in India, so don't use it. But many are still marketed. So marketing is अभी भी चल रही है. So don't give guys because this is ban India, ban. Okay, because this has atropinic activity. What is atropinic activity? Atropinic activity is what increase heart rate. Okay, dryness of माउथ का ड्राइनेस. अब मेरे को लिखने नहीं आ रहा है यहाँ पर बिकॉज माउथ से लिखना थोड़ा इंपॉर्टेंट हो जाना, डिफिकल्ट हो जाता है. Okay, let's see. The aromatic chest rub is what? Aromatic chest rub is widely advertised as a cough remedy. Okay, though it has been shown to reduce the experimentally induced cough in healthy volunteers, so there is no evidence of benefit in pathological cough. So यहाँ aromatic chest rub एक करके आता है जो बहुत ज़्यादा एडवर्टाइज करते हैं. वो बोलते हैं कि चेस्ट के ऊपर रब करो और तो वो रिड्यूस कर देगा कफ को हेल्दी वॉलंटियर्स में, लेकिन उसका कुछ भी एविडेंस नहीं है कि वो पैथोलॉजी को ब्रेक डाउन करेगा कफ की. सो नो यूज. ओके, देन सम एंटीट्यूसिव्स एक्सपेक्टोरेंट कॉम्बिनेशन. एंटीट्यूसिव और एक्सपेक्टोरेंट, ठीक है, एस्टेलिन एक्सपेक्टोरेंट. सो दिस साल्बुटामोल इज एंड गुनिफेसिन. ओके, सो दिस इज एस्टेलिन. सो डोज गाइज ये रीड कर लेना, फिर भी बताता हूँ. 100 mg पर 10 ml सिरप में आता है ये, ठीक है. डोज 10 to 20 ml देना. एस्कोरल. Ascoril C is one of the important drug which is vastly marketed. which contains the codeine. This C is for the codeine, which contains 10 mg, and chlorpheniramine is 4 mg per 5 ml. So chlorpheniramine and uh, codeine. How you will know this core? This is core. Okay, codeine is C. So chlorpheniramine and codeine. So ascorbyl contains this. Xylene. Xylene also contains ambroxol, which is expectorant. Guanfacine 50 mg. Salbutamol is there, and menthol is there. Okay. So bronchosolvine is guanfacine. It contains terbutaline and bromhexine, which is broncho expectorant. Okay. Okay, guys. So read this is very commonly we use. देखो बेनाड्रिल is very, इसकी तो ऐड भी आती है, बेनाड्रिल है ना. So these are some drugs. रीड कर लो उसको, आगे चले. So बहुत सारे कॉस्कोफिन लिंटस भी बहुत ज़्यादा यूज़ होता है. ग्रिलिंगटस भी बहुत ज़्यादा यूज़ होता है. ग्रिलिंगटस में क्या है देखो, डेक्स्ट्रोमिथोर्पेन है, क्लोरोफेनियम है, गुनोफेसिन है और अमोनियम क्लोराइड है. ठीक है. सो ग्रिलिंगटन सॉफ्ट कस ये है. उसके बाद सॉल्विन एक्सपेक्टोरेंट, टॉसेक्स भी बहुत ज़्यादा यूज होता है. टॉसेक्स के अंदर कोडेन है, कोडेन फॉस्फेट है गाइस. ठीक है. सो इसके अंदर कोडेन फॉस्फेट है, क्लोरोफेनिरामिन है, मेंथॉल है. उसके बाद ज़्यादा कॉमनली यूज होने वाला तो बस इतनी ही है. ठीक है, चलो आगे. सो ड्रग्स फॉर ब्रोंकियल अस्थमा. अब ब्रोंकियल अस्थमा के लिए ड्रग कौन सा है वो यूज़ करेंगे. ब्रोंकियल अस्थमा क्या है? इट इज कैरेक्टराइज्ड बाय हाइपर सेंसिटिविटी या फिर हाइपर रिस्पॉन्सिवनेस ऑफ ट्रंकियोब्रोंकियल स्मूथ मसल टू वैरायटी ऑफ स्टिमुलाई and resulting in the narrowing of air tube, and often accompanied by the increased secretion, mucosal edema and the mucous plugging. सिम्टम्स क्या आ जाएंगे? डिस्पनिया आएगा, वीजिंग आएगा, कफ आएगा. डिस्पनिया, वीजिंग एंड कफ, एंड मे बी लिमिटेशन ऑफ एक्टिविटी. सो इसमें क्या बोला है कि ट्रकियोब्रोंकियल ट्री की हाइपर रिस्पॉन्सिवनेस हो जाती है. ठीक है, स्मूथ मसल की. उसके और थोड़ा भी स्टिमुलाई मिला तो स्टिमुलाई क्या 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 हो सकता है? एक एलर्जन हो सकता है, कौन सा भी, डस्ट हो सकते हैं, या फिर एनी एनवायरमेंटल चेंज, एवरीथिंग. ओके. सो उसके फिर क्या होगा? उसके ऐसा हो गया तो उसके वजह से वो जो ट्रकियोब्रोंकियल जो नैरो ट्यूब होंगे, वो सारे एयर ट्यूब होंगे, वो सारे एयर ट्यूब नैरो हो जाएंगे, तो उनका लूमेन छोटा हो जाएगा. सो नैरो हो जाएंगे तो एक्सपेक्टोरेंट का इनहेल और एक्सपेक्ट करने के लिए बहुत तकलीफ होगी. ठीक है. सो जब भी वो एक्सपेक्टोरेट करेंगे या फिर एक्सहेल करेंगे, सॉरी एक्सपेक्टोरेट नहीं, सॉरी एक्सहेल जब करेंगे तब वहां से आवाज आएगी. सो वो साउंड को हम लोग बोलते हैं विजिंग. ठीक है. सो इट इज विसल लाइक साउंड. ओके गाइस. सो डिस्पनिया विल बी मींस डिफिकल्टी, ब्रीदिंग में डिफिकल्टी हो जाएगी. फिर बाद में कफ हो गया, और कुछ कुछ ये होते हैं जहाँ पर म्यूकोसल एडिमा हो जाता है और वहां पर सिक्रेशन भी ज़्यादा बढ़ जाता है. सो ये है अस्थमा. नाउ अस्थमा इज नाउ रिकॉग्नाइज्ड टू बी द प्राइमरली इंफ्लेमेटरी कंडीशन. सो अभी अभी क्या बोल रहे हैं जाना कि ये अस्थमा एक इंफ्लेमेटरी कंडीशन है. ठीक है गाइज. So understood guys, this is inflammatory conditions, some are saying this. So one more thing guys, this Brozedex, look on left side, this contains bromhexine, guanfacine 100 mg, terbutaline, menthol. So this terbutaline is what? Short acting beta bronchodilator. Okay, beta 2 agonist. So Brozedex is quite good syrup. Okay, quite famous. So that's why बोला अपने मार्केट में अवेलेबल है. सो हो गया, ये इन्फ्लेमेटरी कंडीशन है. तो इन्फ्लेमेशन अंडरलाइंग हाइपर एक्टिविटी, ऑफ कोर्स हाइपर एक्टिविटी. सो वो क्या बोल रहे हैं? अस्थमा इज इन्फ्लेमेटरी कंडीशन अंडरलाइंग हाइपर एक्टिविटी. ओके. सो एन एलर्जिक बेसिस can be demonstrated in many adult. So higher percentage of pediatric patients are there. So means sorry. So ये जो condition है वो ज़्यादातर pediatric patient में दिखाई देती है. In others, variety of trigger factor like infection, irritation, pollution, exercise, exposure to cold air, and psychogenic. So this can also act as a trigger factor for asthma. Okay. Then extrinsic asthma is there and intrinsic asthma is there. What is extrinsic asthma? Extrinsic asthma is mostly episodic, means आता है जाता है, so and less prone to a status asthmaticus. आएगा जाएगा और उसके बाद status asthmaticus मतलब मेन अस्थमा के अंदर नहीं जाएगा. इंट्रिंसिक अस्थमा इज टेंड्स टू बी पेरिनियल, ठीक है, मतलब साल में एक बार आएगा. और स्टेटस अस्थमेटिकस इज मोर कॉमन, सो बहुत ज़्यादा इसका अटैक आएगा, एपिसोड आएगा, ठीक है. So mast cells present in the lungs and inflammatory cells recruited as the result of initial reaction produced of a multitude of a mediator by following process. So इसमें क्या होगा, mast cells और inflammatory mediators वहाँ पर चले जाएंगे, ठीक. So this release of mediator store in the granules, okay. So like histamines, protease enzymes and TNF alpha, these are the inflammatory mediators, okay, will play a role in asthma. Which are the histamine, protease enzymes and TNF, okay guys. So then, so also there is a release of phospholipids from the cell membrane followed by mediator synthesis within the minute. So PG, LT and PF, okay. So all these will get uh, release of phospholipids from cell membrane, okay, by mediator. So वो कौन कौन करेगा, PG, LT और PF, ठीक है. सो एक्टिवेशन ऑफ जीन्स फॉलोड बाय प्रोटीन सिंथेसिस. सो क्या होगा, तीसरा क्या होगा, जीन का एक्टिवेशन चले जाएगा समझ 1 घंटे के अंदर. सो एक वापस बताता हूँ. सो दिस विल वट एवर विल हैपन इन अस्थमा, इमीडिएटली क्या होगा, इमीडिएटली देयर इज अ रिलीज ऑफ मीडिएटर्स, ओके. कौन कौन से, हिस्टामिन, प्रोटीज एंजाइम्स और TNF अल्फा, ठीक है. उसके बाद कुछ मिनट में, ठीक है, within some minutes, so there will be release of phospholipids from the cell membrane, okay. so कौन रिलीज करेगा, दिस mediator synthesis, दिस PG, LT and PF, okay. उसके बाद कुछ 1 घंटे में, within an hour, there is an activation of gene, okay. क्यों, उस किसके बाद, प्रोटीन सिंथेसिस के बाद. so उसमें कौन कौन आएगा, so interleukin or TNF alpha will play a role, okay. These mediators together constricts the bronchial smooth muscle. Of course this PG, LT, PAF, TNF, interleukin and all will constrict the smooth muscle and cause the mucosal edema and hyperemia of course, redness. So या फिर blood circulation increase हो जाएगा वहाँ का, produce the viscid secretion and all resulting in the reversible airway obstruction. So asthma is what, reversible disease na. So reversible airway obstruction will be there. So the inflammation perpetuates itself by cell to cell communication and recruitment of more and more inflammatory cells. So क्या होगा, वहां पर रिक्रूट होगा, किसका होगा, इन्फ्लेमेटरी सेल्स का बहुत ज्यादा होते रहेगा, सेल टू सेल कम्युनिकेट होते रहेगा और उसके बाद वहां पर inflammatory cells का recruitment होता रहेगा. So bronchial smooth muscle hypertrophy will be there. So increase in the population of mucus secreting cells. Of course bronchial smooth muscle की hypertrophy होगी, मतलब बढ़ जाएगा, तो उसके वजह से क्या होगा, mucus secreting cells और population, mucus secreting cell का population भी बढ़ जाएगा. उसके बाद blood cells भी वहाँ पर involve हो जाएंगे, occurs over time, okay. And then damage to the bronchial epithelium, ओके. सो ब्रोंकियल एपिथेलियम को डैमेज हो जाएगा और विल accentuate the hyperactivity. So all these are the conditions, all these are the process or the steps in which in asthma, okay. So again the vagal discharge to the bronchial muscle is exhale, ओके सॉरी, एनहांस रिफ्लेक्सली. सो इसके वजह से और क्या होगा, वेगल रिस्पॉन्सिबिलिटी क्या है, इसके वजह से वेगल रिस्पॉन्स वगैरह मतलब कोलिनर्जिक एक्शन हो जाएगी, कोलिनर्जिक एक्शन होगी मतलब ब्रोंको कंस्ट्रिक्शन होगा, उसके बाद सिक्रेशन भी बढ़ जाएगा. सो एयरवे रीमॉडलिंग प्रोग्रेसिंग वर्सनिंग इन द डिजीज. सो अंडरस्टूड, ऑल दीज आर. सो ये सारी स्टेप्स को बार 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 सुन लेना, सो हो जाएगा. अब COPD क्या है, COPD is also an inflammatory disease of a lung characterized by the progressive emphysema, okay. So alveolar destruction हो जाएगा वहाँ पर और bronchiolar fibrosis in the variable proportions. So loss of bronchiolar elasticity leads to the closure of smaller air tubes during expiration. So there is what, bronchiolar elasticity चली जाएगी, देयर इज लॉस ऑफ ब्रोंकियल इलास्टिसिटी, और उसके वजह से क्या होगा, विच विल लीड्स टू द क्लोजर ऑफ स्मॉलर एयरवे ट्यूब्स ड्यूरिंग एक्सपिरेशन। सो एक्सपायर करते समय वहां पर उसका स्मॉल एयरवेज का एयरवे ट्यूब्स क्लोज हो जाएगी, ठीक है। सो दीज एयरवे ऑब्स्ट्रक्शन इज असेंचुएट ड्यूरिंग द एक्सरसाइज कॉजिंग शॉर्टनेस ऑफ ब्रीथ। सो ये कब होगा, सो एक्सरसाइज इंड्यूस, हाँ उस समय, ठीक है। सो द एक्सपायरेटरी एयर फ्लो लिमिटेशन डज नॉट फ्लक्चुएट मार्कली ओवर द लॉन्ग पीरियड ऑफ टाइम, बट there are exacerbations or precipitated by the respiratory infections. So that's why we call this diagnosis as AE of COPD. Okay, so what is this? C, this is exacerbation. So this is exacerbation. This is acute. So acute exacerbation of COPD. Okay, so the patient was a known case of COPD, but he was admitted for this acute exacerbation of that symptoms, so of COPD. Okay, so it is clearly related to the smoking and characteristically starts after the age of 40. So quitting of smoking reduce the rate of decline in the lung function. रेट ऑफ डिक्लाइन इन द लंग फंक्शन। सो अगर वो लंग का फंक्शन कम होना वो कम कर देगा अगर स्मोकिंग छोड़ दिए तो। सो ब्रोंकोडायलेटर्स आर ब्रोंकोडायलेटर्स prevents the closure of peripheral air tube during expiration. So bronchodilator will help in COPD. वो क्या करेंगे, वो जब एक्सपायर करेगा जो एयरवे खुल नहीं रहा था, सो वो क्या करेगा, एयरवे को खुला ही रखेगा, ओके, उसको क्लोज होने नहीं देगा, सो अच्छे से हम लोग एक्सपायर कर पाएंगे। So afford symptomatic relief in COPD patient, but improvement in the force expiratory volume in first second, that is FEV1, following inhalation of the short acting B2 agonist is generally less than 15%, 15. So an increasing part of airway obstruction is irreversible. So this increasing part of the airway obstruction is irreversible. Okay guys, so asthma is reversible, COPD is quite irreversible if it is high degree. Now I hope you have got some knowledge from this. Okay, so approach to the patient कैसा है, approach to the patient and treatment के लिए क्या करना है, प्रिवेंशन करना है अपने को AG और AB रिएक्शंस का, एंटीजन एंड एंटीबॉडी रिएक्शन का। सो एंटीजन एंटीबॉडी रिएक्शन, अवॉइडेंस ऑफ एंटीजन्स, hypersensitization, so possible in the extrinsic asthma and if antigen can be identified. So antigen अगर अपने को पता चला, so वो antigen को जाने नहीं देना है, जैसे कुछ भी एलर्जन होंगे वो नहीं जाने देना है, जैसे डस्ट वगैरह ये सब जाने नहीं, तो वो अवॉइड करते हैं। दूसरा हमको क्या करना है, न्यूट्रलाइजेशन ऑफ IgE, मतलब IgE इज व्हाट, इम्यूनोग्लोबुलिन E, ठीक है। सो उसके लिए अपने के पास एक ड्रग है ओमिलीजुमाब। ओमिलीजुमाब इज वन ऑफ द ड्रग विच वी यूज टू neutralize the IgE, that is a reagenic antibody. Reagenic antibody we call IgE is reagenic antibody. So the suppression of inflammation and bronchial hyperactivity, for that we will use the corticosteroid. ओके, सो इन्फ्लेमेशन और ब्रोंकियल एक्टिविटी को सप्रेस करने के लिए हमको कॉर्टिकोस्टेरॉइड का यूज करना पड़ेगा। उसके बाद चौथा स्टेप है हमारा प्रिवेंशन ऑफ रिलीज ऑफ मेडिएटर। सो मेडिएटर को रिलीज नहीं करने देना है, तो उसके लिए हमको मास्ट सेल स्टेबलाइजर चाहिए। सो मास्ट सेल स्टेबलाइजर क्या है, केटोटिफेन और सोडियम क्रोमोग्लाइकेट ना, क्रोमोग्लाइकेट आई थिंक, इट्स ओके, लेट्स सी। उसके बाद एंटागोनिज्म ऑफ अ रिलीज मेडिएटर, सो ल्यूकोट्राइन एंटागोनिस्ट, एंटीहिस्टामिन्स और PAF एंटागोनिस्ट, ऑल दिस वी कैन यूज। ल्यूकोट्राइन एंटागोनिस्ट कौन सा है, ल्यूकोट्राइन एंटागोनिस्ट मोंटेलुकास्ट और जेफिलुकास्ट, और उसके बाद एंटीहिस्टामिनिक हम दे सकते हैं सिट्रीजिन एंड ऑल, सो PAF एंटागोनिस्ट भी हम दे सकते हैं। सो दीज 5 स्टेप्स आर देयर टू treat the asthma. Okay, so even there are 6, 7 and 8 step. So what is that? So कंस्ट्रिक्टर न्यूरोट्रांसमीटर जो होते हैं, जैसे कोलिनर्जी, जैसे कोलिन वेगल स्टिमुलेशन होता है, तो वेगल स्टिमुलेट को नहीं होना है तो उसके लिए हम लोग उसको एंटी कोलिनर्जिक ड्रग देंगे, ठीक है। दूसरा मिमिकिंग द डायलेटर न्यूरोट्रांसमीटर लाइक सिम्पैथोमाइमेटिक हम देंगे, तो कौन सा, एट्रोपिन ऑफ कोर्स। उसके बाद हम डायरेक्टली एक्टिंग ब्रोंकोडायलेटर देंगे, उसको बोलेंगे मिथाइलजैंथिन। सो डायरेक्टली एक्टिंग ब्रोंकोडायलेटर देंगे मिथाइलजैंथिन, उसके बाद जो डायलेटर का काम करेगा उसके जैसा मिमिक करेगा वैसे न्यूरोट्रांसमीटर देंगे। उसके बाद दूसरा हम ब्लॉकेड ऑफ, मतलब न्यूरोट्रांसमीटर की तरह काम करने वाला, उसके बाद ब्लॉकेड कर देंगे हम लोग कंस्ट्रिक्टर न्यूरोट्रांसमीटर जो होगा उसको। Okay, so all these are the steps involved in our treatment. So now classification, what is that? In classification of treatment of asthma, we'll see the first we will use the bronchodilator. So what is bronchodilator? Beta 2 sympathomimetic we use. So beta 2 sympathomimetic is what? Salbutamol, terbutaline, bambuterol, salmeterol, formoterol, or ephedrine. This salmeterol and formoterol are long acting. Okay, and salbutamol and terbutaline are short acting. Now then we use the directly acting bronchodilator is was methylxanthine. So in that this is theophylline, which comes in anhydrous condition, and aminophylline we use IV, and choline theophylinate hydroxyethyl theophylline ethanolate of piperazine, and doxophylline we take in tablet form also. So anticholinergic we use ipratropium bromide and tiotropium bromide. So make sure ipratropium bromide is not an methylxanthine. Okay, it is a anticholinergic drug, but this also comes under the bronchodilator. Okay, then further leukotriene antagonist. In leukotriene antagonist, zafirolocast and montelukast I just told you, and this mast cell stabilizer, there is ketotifen and the sodium chromoglycate. I just told you, that means I'm right. Okay, the corticosteroid, you know what are all the corticosteroid you use. Many gym taking bundles also knows. Systemic corticosteroid is what? Hydrocortisone, which comes under the IV. Prednisolone is also there. And inhalation, there is a beclomethasone, dipropionate, budesonide is the which comes for the inhalation. Nebulizer, fluticasone propionate is also there, and flonisolide and cyclosonide. Okay, cyclosonide, flonisolide, fluticasone propionate, budesonide, and beclomethasone dipropionate. Then we'll use anti-IgE antibody, omalizumab, 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 omalizumab. Okay, now we'll see sympathomimetic drugs. Okay, for this detailed discussion we'll see chapter 9, but now concentrate on this. Adrenergic drugs cause the bronchodilation through beta 2 receptor stimulation. Okay, एड्रेनर्जिक ड्रग देंगे हम लोग, तो एड्रेनलिन, लाइक एड्रेनलिन ही दे दिया समझ लो, ठीक है। तो वो क्या करेंगे? ब्रोंकोडायलेशन करेंगे बीटा 2 रिसेप्टर को स्टिमुलेट करके। सो व्हाट दे विल डू, दे विल इंक्रीज द साइक्लिक एएमपी फॉर्मेशन इन bronchial muscle cell. Okay, what they will do, they will increase the cyclic AMP formation, okay, in cell of bronchial muscle. Then what they will do, they will relax. Okay, they will relax the smooth muscle or relax the muscles of bronchus. So in addition, increase cyclic AMP in the mast cells and other inflammatory cells decreases the mediator release. So what it will do, it will also in addition to this increase cyclic AMP in mast cell, it will also inflammatory cells को decrease करेगा, और या फिर mediator release करने से, ठीक है। Since beta 2 receptors on inflammatory cells desensitize quickly, okay, and contribution of these actions to the beneficial effect of beta 2 agonist in the asthma. Beta 2 agonist and beta 2 receptor on inflammatory cell desensitize very quickly, so that's why this is beneficial effect of beta 2 agonist. So when airway inflammation is chronic, so it's uncertain and at a best minimal. So adrenergic drugs are the mainstay of the treatment of a reversible airway obstruction. Okay, reversible airway obstruction, but should be used cautionly in the hypertensive ischemic heart disease patient and in those receiving the digitalis, of course, because it can increase the heart rate. Okay, so they are most effective and the fastest acting bronchodilator when inhaled. So inhalation is the fastest route, right? So through the adrenaline we give, so beta 1 and beta 2 and alpha receptor agonist है adrenaline, or isoprenaline also is there, so it is also beta 1 and beta 2 agonist, not only alpha receptor agonist. So in addition to isoprenaline, adrenaline is alpha 1 receptor agonist also, alpha receptor, and are more effective bronchodilators. So it is the selective beta 2 agonist that are now used in the asthma to minimize the cardiac side effect. So these can be used, so like isoprenaline can be used to minimize the cardiac side effect. It's okay. Now salbutamol. In salbutamol, of course, salbutamol we also call it as albuterol, so a highly selective beta 2 agonist. Of course, सिलेक्टिव बीटा 2 मींस बीटा 2 को सिलेक्टिवली वो अगोनिस्ट करेगा, मतलब स्टिमुलेट करेगा, ब्रोंकोडायलेट करेगा. सो कार्डियक साइड इफेक्ट्स आर लेस प्रोमिनेंट, so that's why we give salbutamol. So selectively is a further increase by inhaling of a drug. So this drug, if we inhale, then it will act more. Okay, so inhale salbutamol delivered mostly from the pressurized meter dose inhalator, so MDI. So meter dose inhalator जो होता है उससे हम लोग उसको देते हैं. सो इसके अंदर क्या होता है, प्रेशर करके रखते हैं उसको, और जैसे प्रेशर मारेगा वो बाहर जाएगा. प्रोड्यूसेस द ब्रोंकोडायलेशन विद इन द 5 मिनट्स. 5 मिनट के अंदर उसका रिस्पॉन्स चले जाएगा, और उसका एक्शन होता है 2 से 4 घंटे. सो 2 से 4 घंटे तो कुछ तकलीफ नहीं होगी उसको. सो इट इज देयर फॉर यूज टू अबॉर्ट द एंड टर्मिनेट द अटैक ऑफ अस्थमा. सो दैट्स वाई यू नीड टू गिव salbutamol inhalation or MDI, metered dose inhaler. Okay, but is not suitable for round the clock prophylaxis, of course. So ये अच्छा नहीं है, like दोपहर को ले 3 को सुबह दोपहर रात को ऐसा राउंड द क्लॉक नहीं दे सकते. So muscle tremors are the dose inhale side effect. Of course muscle tremors होगा, palpitation होगा, restlessness होगा, nervousness होगा, and throat irritation, ankle edema also can be occur. So most importantly muscle tremors is the main side effect of this inhale, but also palpitation, restlessness, nervous, throat irritation and ankle edema are also very common. So hypokalemia is the possible complication. What is possible complication? Hypokalemia means what? Potassium will get less. Okay, so hypokalemia, so level of potassium can drop in salbutamol users. So that's why when your patient is on salbutamol, so you need to check your potassium on regular basis. If it is on regular, if the patient is taking long time, salbutamol undergoes the pre-systemic metabolization in the gut wall. So उसका मेटाबोलाइजेशन कहाँ होगा? प्री सिस्टमिक सिस्टम से में जाने से पहले गट वॉल के अंदर. दूसरा ओरली लेगा तो ओरल बायोअवेलेबिलिटी इज 50%. ओरल साल्बुटामिल एक्ट्स फॉर द 4 to 6 hours. सो ओरली लेगा तो उसका एक्शन कितना देर तक होगा? 4 to 6 hours, एंड इज अ लॉन्गर एक्टिंग and the safer than the isoprenaline but not superior in the bronchodilator efficacy. अगर bronchodilator के इफेक्ट अगर देखेगा तो अच्छा है isoprenaline का. Okay, this is isoprenaline we have seen ना, this isoprenaline. Okay, so उसका इफेक्ट ब्रोंकोडायलेटर के अंदर देखेगा तो अच्छा है, लेकिन सेफ अगर देखेगा तो कौन सा है? सेफर साइड में हम लोग को साल्बुटामोल बेस्ट है. अगर ओरली देंगे तो 4 to 6 hours तक उसका एक्शन रहेगा. 50% उसकी बायोअवेलेबिलिटी है अगर हम लोग उसको ओरली देते हैं तो, और गट वॉल से उसका प्री सिस्टमिक मेटाबॉलिज्म स्टार्ट हो जाएगा. सो बिकॉज ऑफ द मोर फ्रीक्वेंट साइड इफेक्ट्स, oral beta 2 agonist therapy is reserved for the patients who cannot correctly use inhaler or as a alternate adjuvant drugs in the severe asthma. Again I am telling you this. See, because more frequent side effect, of course इसके side effect ज़्यादा है, और इसलिए oral beta 2 agonist is reserved for the patients who cannot correctly use inhaler. जो इनहेल ठीक से नहीं कर पाएंगे उनको हम ये देंगे ओरल. ओके, एज एन अल्टरनेटिव. सो ड्रग इन अस्थमा. सो 2 to 4 mg ओरल उसका डोज है, और 0.25 से 0.5 mg इसका IM या फिर सबक्यूट हम लोग इसको दे सकते हैं, और 100 से 200 माइक्रोग्राम उसको हम लोग इनहेलेशन में देना है. सो इसको अगर हम लोग देखेंगे इसका डोज, तो ये है कि 2 से 4 mg तक हम लोग देंगे ओरली. 0.25 से लेकर 0.5 mg हम लोग इसको देंगे IM और सबक्यूट, एंड 100 से 200 माइक्रोग्राम इसको देंगे हम लोग इनहेलेशन, ठीक है गाइस। देन अस्टालिन हम लोग देखेंगे, अस्टालिन के अंदर देखेंगे तो 2 से 4 mg टैबलेट हम लोग दे सकते हैं, उसके 8 mg सस्टेन रिलीजिंग टैबलेट आता है, 2 mg फॉर 5 ml सिरप आ जाएगा, 100 माइक्रोग्राम का मीटर डोज इनहेलेटर आ जाएगा, ठीक है। उसका और एक ड्रग का ट्रेड नेम है डेरी हेलर वेंटोर वेंटोरलिन, ये भी ड्रग है। Okay, single enantiomer preparation of R-salbutamol R is there, uh, R-salbutamol is there, has also been marketed. Okay, because it is only a single enantiomer of this. So because it is active beta 2 agonist and more potent bronchodilator, which may produce fewer side effect than the racemate. So enantiomer उसका salbutamol का है, वो कौन सा है, R-salbutamol. सो वो क्या है, पोटेंट ब्रोंकोडायलेटर है जो और कम साइड इफेक्ट भी प्रोड्यूस करेगा, मार्केट में है। Now we'll see terbutaline. So in terbutaline is was it is similar to the salbutamol in the properties and the use. So same as terbutaline salbutamol का बस 5 mg ओरल देते हैं इसको, और 0.25 mg सब्स्टिट्यूट देंगे, और 250 माइक्रोग्राम इनहेलेशन में देंगे। टर्बुटालिन के ये भी आता है, सिरप भी आता है ना, सो ब्रिकारेक्स 2.5 mg या फिर 5 mg टैबलेट देंगे, मिस्ट हेलर 250 माइक्रोग्राम पर मीटर डोज, तो उस हिसाब से इसका डोज है। लेट्स गो फर्दर गाइस। So inhale salbutamol and the terbutaline are currently the most popular drugs for the quick reversal of a bronchospasm. Salbutamol and terbutaline is the most popular, but should not be used on any regular schedule. So regular use does not reduce the bronchial hyperactivity. सो रेगुलर अगर हम लोग ने यूज़ किया तो उसका कुछ मतलब नहीं है, कुछ ब्रोंकल हाइपर एक्टिविटी कुछ कम नहीं करने वाला, सो मे इवन वर्स भी हो सकता है। सो दिस मे बी रिस्पॉन्सिबल फॉर द डिमिनिश रिस्पॉन्सिवनेस सीन आफ्टर द लॉन्ग टर्म यूज ऑफ दिस ड्रग। सो इसका मतलब क्या होगा, अगर ज़्यादा बार ले रहे, लॉन्ग टर्म ले रहे, तो कुछ कुछ कंडीशन में उसका इफेक्ट भी कम हो जाएगा। सो रेगुलर यूज ऑल्सो डाउन रेगुलेट्स द ब्रोंकियल बीटा 2 रिसेप्टर्स। रेगुलर यूज ऑल्सो डाउन रेगुलेट्स beta 2 receptor. Of course, it is advised that the patients requiring a regular medication should be treated with a inhaled steroid. So steroid से हम लोग treat करें with or without inhaled long acting beta 2 agonist. Okay, long acting is what, salmeterol or formoterol. So while short acting beta 2 agonist inhalers should be restricted to the symptomatic relief for wheezing. So इसका मतलब क्या, जब सिम्टोमेटिक मतलब अस्थमा का अटैक आ गया तो हम लोग उसको शॉर्ट एक्टिंग इनहेलर देंगे, और उसके बाद ये लॉन्ग एक्टिंग जिसको देना होता है, लॉन्ग एक्टिंग हम लोग नहीं देंगे, उसके बदले हम लोग उसको क्या देंगे, कॉर्टिकोस्टेरॉइड देंगे, ठीक है। और ज़्यादा अगर रेगुलरली लॉन्ग लॉन्ग टाइम में देंगे उसको, मतलब बहुत दिन तक, तो उसका इफेक्ट लेस भी हो सकता है। देन Bambuterol is what, this is a biscarbamate ester product, this is product, okay. Biscarbamate ester is the product of terbutaline. So Bambuterol is what, it is slowly hydrolyzing the plasma में इसका हाइड्रोलिसिस होगा, हाइड्रोलाइज हो जाएगा, और लंग्स बाय सूडोकोलिनेस्टेरेज नाम का एंजाइम है, वो उसको हाइड्रोलाइज कर देगा टू रिलीज द एक्टिव ड्रग। सो उसके बाद एक्टिव ड्रग रिलीज होगा ओवर 24 आवर्स, तो 24 आवर्स तक वो रिलीज होगा, एंड रिवर्सिबल इनिबिशन ऑफ सूडोकोलिनेस्टेरेज अकर्स इन द डोज डिपेंडेंट मैनर। सो सूडोकोलिनेस्टेरेज का इनिबिशन रिवर्सिबल हम डोज डिपेंडेंट मैनर हम कर सकते हैं। सो इट इज इंडिकेटेड इन द नॉक्चर्नल एंड क्रॉनिक अस्थमा एज अ सिंगल इवनिंग डोज ऑफ 10 to 20 mg ओरल। सो नॉक्चर्नल मतलब रात को अगर जो अस्थमा आता है उसको हम लोग इसको दे सकते हैं, ठीक है। सो बीटा डे इसको नाम देते हैं, बीटा डे ट्रेड नेम है इसका, मार्केट नेम। और उसके बाद बैम्बूडिल भी नाम है उसका, ठीक है। 10 mg 20 mg का टैबलेट आता है। और ये सालमेट्रॉल तो पता है अपने को, फर्स्ट लॉन्ग एक्टिंग सिलेक्टिव बीटा 2 agonist है, which with a slow onset of action and used by inhalation twice daily schedule for maintenance therapy and for nocturnal asthma. ठीक है, नॉक्चुरनल मतलब क्या, नाइट में, ठीक, बट नॉट फॉर द अक्यूट अस्थमा. सो अक्यूट सिम्टम्स के लिए नहीं देना है, जिसको नॉक्चुरनल आता है उसके लिए देना, नॉक्चुरनल या फिर मेंटेनेंस थेरेपी के लिए, ताकि ना आए. So it is more beta 2 selective than salbutamol. Beta 2, it is the selectivity of salmeterol for beta 2 is more compared to salbutamol. Okay, so as well as more lipophilic भी more है, मतलब lipid loving है, which probably accounts for its longer duration of action. So lipophilic है, इसके लिए इसका longer duration तक action है, ऐसा हम लोग बोल सकते हैं. So concern of asthma worsening due to regular use of inhaled beta 2 agonist applies to the salmeterol also. So recent epidemiological studies indicate that the risk of life-threatening asthma attacks may be increased by regular use of लाइफ थ्रेटनिंग अस्थमा अटैक भी हो सकता है अगर हम लोग रेगुलरली बीटा 2 अगोनिस्ट यूज करते हैं तो. सो कंकरेंट इनहेल स्टीरॉयड अपीयर्स टू लिमिट दिस रिस्क. सो स्टीरॉयड्स को भी इन बिटवीन यूज करना चाहिए ताकि ये रिस्क हम कम कर सकते हैं. सो एक्सेस मॉर्टेलिटी अमॉन्ग अस्थमेटिक treated continuously with a long-acting beta-2 agonist inhalation has been reported. However, the clinical studies have shown sustained improvement in the asthmatic symptoms and lung functions in majority of patients. So clinically हमको ये पता चला है कि ये lung function और अस्थमा का एपिसोड कम करने के लिए ज़्यादा काम आया है. So concurrent use of inhaled salmeterol with the inhaled glucocorticoid produces effect equivalent to the double dose of the corticoid alone. सो अगर कॉम्बिनेशन में यूज किया तो कॉर्टिकॉइड का डबल डोज के जरा वो काम करेगा. सो इट इज advocate that the long acting beta 2 agonist should be used only in the combination with the inhaled steroid and combined formulas are available. So it is advocated means बोला जा रहा है कि भाई दे सकते हो तुम लोग, ज़्यादा से ज़्यादा दे दो. सो सीओपीडी के अंदर हम लोग देंगे लॉन्ग एक्टिंग बीटा 2 अगोनिस्ट आर सुपीरियर. लॉन्ग एक्टिंग हम लोग कब देंगे, सीओपीडी में, एंड टू शॉर्ट एक्टिंग वंस एंड इक्विवेलेंट टू इनहेल एंटी कोलिनर्जिक इन सीओपीडी. तो सीओपीडी में हम लोग लॉन्ग एक्टिंग देंगे और शॉर्ट एक्टिंग कहाँ देंगे, सिम्टोमेटिक अस्थमा में. So they reduce the breathlessness by preventing expiratory closure of peripheral airways and abolishing the reversible component of airway obstruction. ठीक है guys. So यहाँ पर हम लोग को एक एग्जांपल्स मतलब यहाँ पर मिलता है रोटा कैप्स है. Okay guys, so rota caps are there which will be in combination. Salmeterol or sorobid will also be get in combination drugs, which has Seroflow is also there. Seroflow contains salmeterol, fluticasone, and this Seroflow 125 and 250 mg combination. This is 100, 250 and 500 rota caps are there. ठीक है, combine inhalers are these. Then now, okay guys, so formoterol, another long-acting beta 2 selective agonist, for 12 hours is the action when inhaled, and compared to salmeterol it is the faster action, and it is used on regular morning evening schedule for round the clock bronchodilation. So for round the clock bronchodilation you can use the formoterol. 12 to 25 microgram is the dose by inhalation twice a daily, and it also go on for attack. For attacks 12 micrograms rota caps are there. Ephedrine is the one oral sympathomimetic drug which has alpha beta 1 beta 2 actions. This will act like adrenaline and causes a mild slowly developing bronchodilation lasting for 3 to 5 hours. So it is constituent of older combination formulations and is used for the mild to moderate chronic asthma. So because of the low efficacy and the frequent side effect, it is not preferred now. So low efficacy है इसकी और frequent side effect बहुत ज़्यादा है, इसलिए इसको हम use नहीं करते. ठीक है guys, so okay guys, so we'll stop here because video is also getting long. So we'll see this further chapter in part 2 section of this 16 chapter part 2 section 4. Okay. So till now, then we'll see methylxanthine and further drugs. Okay, thank you guys. So if this has added some information in your knowledge, so do like, share, subscribe. This will help me, or this will motivate me to do more videos like this for you. Okay guys, thank you, good day, stay safe.